College of Medicine leadership present here, faculty and students, partners, colleagues, ladies and gentlemen, Assalamu alaikum and good afternoon to everyone. It is an honor for me to stand before you today to commemorate the World Mental Health Day 2025, a day that reminds us that there is no health without mental health. This year's theme, which is mental health services in humanitarian emergencies, could not be more relevant for Pakistan and for the world at large. The World Mental Health Day is not only a day of awareness, it is also a day of advocacy, a day of action. It is a day to renew our collective commitment to protect mental health as a human right and also to ensure that every person, including those living through emergencies, have access to care, compassion, and hope. Globally, as it has already been highlighted, 1 in 7 people are living with a mental health condition. This means that even many among us in this room are facing or have faced some sort of mental health issue. WHO's message is clear. It is okay to need support, and it is important to take care of ourselves and our mental health. Pakistan is no exception, and when floods strike or conflict displaces families or health systems are overstretched due to an emergency, such as the recent climate-driven floods that we have had, these needs multiply quickly and often silently. Yet, despite the urgent need, access remains far too limited. Many people suffer in silence because mental health and psychosocial support are not systematically integrated into emergency health responses. Honorable Minister, ladies and gentlemen, investing in mental health is investing in recovery, and investing in mental health care also saves lives. Investing in inclusive mental health care leads to stronger communities, and investing in mental health is essential for rebuilding lives. Because beyond the services that we provide, survivors also need mental health and psychosocial support to cope, to recover, and also to rebuild. One of the strengths of Pakistan is precisely its strong sense of community and family support to help others when they are going through difficult moments. At some point of our lives, we all need some kind of mental health support. The WHO Comprehensive Mental Health Action Plan 2013 to 2030 underlines that mental health is critical for every emergency preparedness and response effort, from the earliest stages of a crisis through the recovery and also rebuilding. What this means is that training healthcare workers to recognize and manage psychosocial distress is important. Embedding mental health and psychosocial support within primary health care is important. Ensuring essential psychotropic medicines are available even during emergencies, and involving communities in designing and delivering culturally appropriate care is also key. In Pakistan, under the leadership of the Ministry of National Health Services, Regulation and Coordination, with support from WHO and partners, mental health has been integrated into the UHC benefit package, and the WHO MH-GAP program is being implemented at some primary health care levels. These are important beginnings, and we have now the opportunity to move from projects to systems and from short-term relief to long-term resilience. WHO stands with Pakistan and all partners to act with renewed urgency to further integrate mental health into all emergency preparedness and response plans, build capacity at all levels, from community health workers to hospital teams, to provide basic psychosocial or psychological sub-first aid and referral, ensure continuity of care so that mental health services remain available even when systems are disrupted, and strengthen coordination and data systems to better identify needs, measure progress, and guide action. Invest sustainably because scaling up access requires predictable financing, not short-term projects. And empower communities because healing begins when people are supported to help one another. Today, WHO reaffirms its commitment to work hand in hand with the government of Pakistan, health professionals, academia, partners, to ensure that mental health is fully recognized as an essential component of emergency response and recovery. Because there is no resilience without mental health, and there's no health without mental health. Shukriya, and thank you for inviting me.